Hi there, I'm Dr. Thomas Heil, and I would like to speak with you for a minute about narcotics, or opioids as most people know them now from all of the information in the news media. I have been in practice for a long time, a little over 20 years now, and I have seen patients on extraordinary doses of narcotics. Back when I began about 20 years ago, that was sort of the standard of care. And what we have learned over decades of treating patients with narcotics or opioid pain medicines is that they just don't work over time the way we had hoped they would. They're very effective for short-term use, and in very limited circumstances, they're good for long-term use. But they really are only part of a treatment plan for someone that has any sort of complex chronic pain. So we try to do everything we can to minimize the use of narcotics, and in many cases, although it's somewhat counterintuitive to patients, when they're on large doses of pain medicines and they're still having pain, the answer to that problem is not to escalate the pain medicines or take more. It's to get off of them entirely, or try to get off of them as low a dose as you can. Because there is a condition that is unusual with narcotic pain medicines where after a certain period of time they can actually make the pain worse rather than better. So patients that are already in pain never want to even have a discussion about trying to cut back on pain medicine because they're already hurting and they're on pain medicine. So it's a difficult thing to come to grips with, but in so many cases we have had great results with getting patients to come off of pain medicines without having any worse pain, and they actually don't have to suffer the side effects of the pain medicines that come along with them. The drying of your mouth, constipation, drowsiness, and the constant need to be attached to a prescription bottle. So we use interventional measures or nerve blocks and minimally invasive procedures as alternative methods to help with reducing pain so that we just don't need to keep pain medicines around at least in the strength and the volume that we used to before.